This morning, Dr. Gold and I have signed a memorandum of understanding to provide financial support for a project described as transformational for the City of Omaha. The MOU identifies $93 million in city funds to support Project NExT and the UNMC expansion west of Saddle Creek Road over the next decade. Project NExT is proposed multi-billion dollar federal disaster response center and state-of-the-art medical research and training facility plan for UNMC and Nebraska Medicine Campus. Within the next month, several sites will be designated as the new federal locations. Project NExT will be funded through a public-private partnership between local, state, and federal government and private and philanthropic support. Our financial support and partnership is critical for this project. The investment will provide enormous opportunities for our city. Estimates show that Project NExT will create more than 8,700 permanent jobs and 41,000 construction jobs. The economic impact to the city is projected to be approximately $1.9 billion each year during construction and $1.3 billion annually after the opening. The MOU pledges up to $45 million for Project NExT and $48 million for public improvements, streets, and a public parking garage on the adjoining Saddle Creek campus. So, where will the money come from? We will designate $4.5 million annually to Project NExT from the occupation tax collected on the tobacco and vaping products over the next 10 years, beginning in 2023. The Omaha City Council passed the tobacco tax ordinance in 2012 to help finance the Fred and Pamela Buffett Cancer Center on the UNMC campus. Excuse me. In 2019, the council removed that sunset provision that would have ended the tax in 2022 and added vaping products to the ordinance. Currently, we collect between $4.2 and $4.5 million every year in the tobacco tax. The public parking garage will be financed with lease purchase bonds. Other infrastructure improvements, including streets, will be funded with transportation bonds in the 2021-2026 capital improvement plan. Our support will not increase taxes. The state of Nebraska has already approved $300 million for the NExT project. Last year, Governor Ricketts signed a bill committing funding contingent on additional finance support for the project. Our medical center is uniquely qualified to respond to public health crises and other types of national threats. We have seen that firsthand with the treatment of Ebola patients and now COVID-19 patients. Project NExT places Omaha in a competitive position to attract and retain the best and the brightest talent. Building great partnerships is the way we get things done in Omaha. This partnership is one that will lead to unmatched employment and development and growth in our city. And now I would like to invite Dr. Gold up to the podium. Dr. Gold.
Well, thank you, Mayor Stothert. It's a great pleasure to be with you on this historic day. I'd like to first and foremost extend our thanks to Mayor Stothert and to the City of Omaha for this critically important commitment to Project NExT and the development of the surrounding areas. Project NExT, as we call it, short for Nebraska Transformation, will provide a world-class home for an academic medical center. It will provide for health security for our nation, as well as provide an economic injection that drives development and prosperity in Omaha for decades after decades. We continue to work very hard to secure the necessary funding from the private and public sector, and particularly from the federal government. To that end, Project NExT will be funded through a public-private partnership between local, state, and federal governments and the private business and philanthropic communities. To date, there has been tremendous enthusiasm from these stakeholders about this project. The University of Nebraska Medical Center and Nebraska Medicine together are uniquely qualified to respond to the public health crisis and other types of national threats that we've seen firsthand with the treatment of Ebola patients and now, tragically, with COVID-19. Project NExT will place Omaha in a competitive position to attract and to retain the best and the brightest healthcare professional, public health, and so many other types of talent. Again, we are deeply thankful to the City of Omaha for this commitment, and we will not disappoint. Thank you so much, and now back to you, Mayor.
Thanks, Dr. Gold. Questions?
Mayor, correct me if I'm wrong, in 2012 as a member of the council, didn't you vote against the tobacco tax?
I did.
And now you're benefiting from it.
I would say the city is benefiting from it. Absolutely. Right. It was due to sunset. The council recently removed that sunset, and I agreed with them when they removed the sunset. So it is generating actually more dollars than we anticipated it would. Like I said, between $4.2, $4.5 million a year, and that revenue continues to come in. We knew that we could use it for a greater benefit of the community, and so I was grateful that the city council removed that sunset. So yes, that's correct, Joe. Other questions? Yes, Brian?
Dr. Gold, can you walk me through the funding here? What you're expecting to get from the feds and the total cost, and because you said private, public, and right now it looks like you have a few $1 million.
A few $100 million, yes. So this is still very much a work in progress. The 2020 National Defense Authorization Act, Section 740, specified the framework of the project. It was reiterated and strengthened in terms of its acceleration, urgency, and scope in the National Defense Authorization Act of 2021, Section 741. So there are several stages that need to occur from the federal perspective. The first is site selection. And there's a study ongoing from Defense Health Agency and the Uniformed Services University to issue a report, hopefully in the very near future, as the mayor said, regarding site selection. The second component of that will be what's referred to as scope and requirements. How many beds, how many operating rooms, what specifications for air handling, etc. That work is also being done by a separate study by the Department of Defense, and that will come out over the summer. Therefore, until we really have a good understanding of how many square feet, how many beds, etc., it's not possible to be exact in terms of the financial scope of the project. But it is estimated, based on the numbers that the mayor just shared with you, to be no less than approximately 2.5 to 2.7 billion, and probably no more than 4.2 to 4.3 billion dollars. Understand that this is not just clinical space, this is not just infrastructure, but this is research space, special pathogens, testing, vaccine development, training for the active military, training for the National Guard, training for the NDMS. So this is a comprehensive, programmatic approach to health security for our nation. The National Defense Authorization Act requires that the Department of Defense identify a minimum of one and as multiple up to 5 programs in the first phase. That is to say, these are not programs that are going to compete with each other. These are all program sites that will be selected for the first phase of what may be 2 or 3 phases before the process is complete.
So to be clear, the UNMC Expansion West does not necessarily mean that the site selection for Project NExT is still up in the air. We'll go there?
Until we have affirmation of site selection, by the federal government until their work the work of the Uniformed Services University and DHA becomes public. It's certainly not possible, as I stand here today, to affirm site selection.
But you think that's not a bad spot?
I think that if you look at the criteria that are specifically identified in the 2021 National Defense Authorization Act, in proximity to both military and civilian air transport, in proximity to an established academic medical center with experience in highly infectious agents, training National Defense Medical Services, work with the United States Air Force Mobility Command, and on and on. There's a list of about 20 criteria that are specified in the law. We meet every one of those criteria.
When do you expect to hear definitively that you'll be a part of this?
Well, the National Defense Authorization Act specifies, again, that one, it is to be accelerated, and secondly, that the site announcements are to occur on or before 31 March 2021, and that would be tomorrow. However, given a lot of different factors in play, it wouldn't surprise me if it is somewhat delayed from that. But, you know, this is in their hands and certainly not in ours. And the way, just so to be clear, the way the announcement will be made is that the Department of Defense and the DHA USU leadership will present their reports to the House and to the Senate Armed Services Committee, and at which time it will become public.
Dr. Gold, you say this puts us in a competitive position. Who are we competing with specifically for NExT and also for the talent that you'll need to populate this?
You know, I really don't know because no one has stepped forward we collaborate with a lot of other centers across the United States. NETEC, the National Emerging Special Pathogens Program, has got 10 major hubs across the 10 healthcare districts of the United States, which are, you know, geographically distributed. We are the headquarters for Region 7, as you probably know. And so my guess is there's probably at least one institution in each of those locations that would at least be somewhat eligible. But there are so many other criteria. For instance, we are the only federally identified quarantine and isolation unit in the United States. We own the largest number of biocontainment beds in the United States. And we just constantly are working with the federal government. You may recall we repatriated in partnership with the National Guard a large number of American citizens from Wuhan City in China just over a year ago. We had the privilege of caring for a large number of infected patients off the Diamond Princess cruise line. And hardly a week goes by that our federal partners, either in the Department of Defense, the Department of State, the Department of Homeland Security, don't reach out to us to partner either on a research project, a clinical project, or an educational training project. We are the home of the United States Air Force CSTARS program for emerging pathogens and highly infectious agents, which means that that is how the Air Force trains individuals who ultimately will have to transport infected active military around the world. So these are all what I would characterize as relatively unique opportunities that really cause distinction and distinctiveness for our site. And hence, I am optimistic about the chances of being selected as one of the 5 sites.
This might be for the mayor or maybe Steve, but the $45 million for NExT specifically, is that earmarked for anything specific, or how can that be used?
Let's both answer that. You do first and
I'm assuming you're talking about the part that's coming from the tobacco tax. It's not necessarily earmarked for anything particular, but it has to be used for public good. And this obviously would qualify in healthcare.
Mm-hmm. Yeah, I just wanted to reemphasize that the city's contribution is critical for this project to move forward. It's a partnership between the Med Center, federal government, state government, and the city of Omaha. If any mayor or any mayoral candidate would say this is not a good move, I would say they did not have the best interest in the city of Omaha in mind. When you talk about 41,000 construction jobs during the construction, and you talk about 8,700 permanent, good-paying jobs Once it is finished, this will be transformational for the City of Omaha. The total amount of money that the City of Omaha is committing in the MOU is $93 million. Part of it will come from the occupation tax, which is the tobacco tax. All occupation taxes go into the general fund. They all go into the general fund, and we use it to fund city services. That's where it goes now. Our commitment to the Med Center, when that was passed, was in 2012. And it was for 10 years, $3.5 million a year for 10 years. So that would have sunset in 2022. But like I said, the council removed that sunset, so it will go on and on. So I cannot think of a better good to serve the public than to use this amount of money that continues to flow in, not a new tax, but continues to flow in from that tobacco tax once we've made our commitment to the Med Center with the Cancer Center. Now, the other two tranches of money are lease purchase bonds that we could use for the garage, and then transportation bonds, which are general obligation bonds for the public infrastructure. It's important that I point out that these transportation bonds and the lease purchase bonds are very specific in what they can be used for. And so if anyone would say, well, we should be using them for potholes or we should be using them for roads, they cannot be used for that. They're very specific of how we use those. Those transportation bonds will be put into and incorporated into our CIP. And then the lease purchase bonds will be paid for, obviously, the way that we pay for lease purchase bonds. And it will be a public garage, and we will own that garage like we do many garages. So altogether, the commitment is $93 million, but it comes from basically 3 different tranches of money. And the important thing is it will not increase taxes. These are very specific at how these dollars can be used. But the results, like I said, our participation is critical for this to happen. And the results, and hopefully we will hear soon, are just going to be transformational for the City of Omaha. The expansion that will happen around the Med Center, from not only the Med Center itself, but for residential, for development that will spur and happen around there, for new people to be moving into Omaha, new professionals, it will be transformational, and it is a once-in-a-lifetime opportunity that we have here in Omaha.
Mayor, do you anticipate any TIF financing or any other sort of financing on this project? And secondly, any projections about what kind of revenue this project will bring into the city?
Oh, yes, we do. In fact, I said that when we were talking, but I got to look at the numbers here again. But during the original construction, I think we are talking about 1.9. The economic impact to the city is projected to be approximately $1.9 billion each year during construction and $1.3 billion annually after the opening. That's the economic impact to the City of Omaha. That is just, those are phenomenal numbers.
And what about any additional financing, like TIF financing or anything else you anticipate?
You want to?
Remember, the TIF can really only be used for a private developed location. A publicly owned or not-for-profit doesn't qualify for property tax, so there isn't any property tax increment to provide to them. So no, there probably will not be any.
Very well, then perhaps I'm misunderstanding some things here. Because as I understand your development, it will also involve some, other projects, some businesses and the like will also be part of this project, will it not?
So the hope is that that will spontaneously occur, but that is not what these funds are going to be used for. I can't imagine that there won't be increased hotel occupancy, restaurants, residential, mixed retail, and other such things that will continue to grow as they have. Last January marked 7 years since I've been here in Omaha, and the amount of growth, economic development surrounding the Med Center, not financed by the Med Center at all, but just new residential facilities, restaurants, coffee houses, other such things, has just been absolutely amazing. And this project, because of the economic impact of it, if you do the back-of-the-envelope math, we're talking about adding approximately 2.5 million square feet. I mean, that is a lot of square feet for any construction project, let alone something of this type.
So, but these big private businesses you're talking about that will be growing will be on the Med Center property, correct?
Some of them will be on the Med Center property, hopefully, but some of them will be surrounding. Most of the ones that I just referred to over the last years have not been on the Med Center property. They've been on the surrounding, Dewey, Harnum, Farnham, You don't have to look far up Farnham Street to see the tremendous amount of economic development that has occurred. You know, what we hear from our employees, more and more of them, is they want to live around the Med Center. They want to bike, they want to walk, they want to take public transportation. And so we're very grateful for all of those things, and that has continued to spur the economic development.
Dr. Gold, looking at the timing of this announcement and the upcoming, in the next week and month, city election, isn't there an appearance that UNMC is putting a thumb on the scale for the city election for the mayor?
Well, this process started in 2014. The need to get this announcement made in a timely fashion as possible is to do everything we can to convince the federal government that the state of Nebraska and the city of Omaha are going to be active and willing partners in this process. Given the fact that the final site selection is going to occur, literally within weeks from now, the timing is really quite important to us, and I believe will be recognized and acknowledged by the federal, our federal partners in the Department of Defense and Uniformed Services University.
I'd make a comment on that too. As Dr. Gold said, this started with the Ebola crisis 6 years ago. That was my first term that I was mayor. The state of Nebraska and the governor have already committed $300 million. The governor is not up for re-election now either, Joe. And so we've had many, many partnerships in the last 8 years since I have been mayor. And it's not based on when the election is at all. It's based on the need and the good of the city. And this project, this one in particular, is so transformational for the city of Omaha and so beneficial for the entire country. It's a once-in-a-lifetime opportunity, and it's something that we cannot and should not pass up. And as Dr. Gold said, it is a matter of days maybe before we even hear from the federal government of where these sites are going to be selected and what the first site may be. And so this is the time that we think is right to announce this. We've come to an agreement. I have to thank Troy Anderson, one of my deputy chiefs of staff, that worked very hard with the Med Center on this MOU. We've been working on it for some time, but we want to let you know when we have something to announce. We want you to be current on what we have been doing, and that's why right now is the right time to announce this.
Dr. Gold, let's say this was already functioning, right, a year ago. How would you have seen this project NExT and the expansion of handling the pandemic? How do you see that would have happened if this were in place a year ago?
Yeah, so if you were to turn the clock back a year, it was January 23rd, 2020, that the first American was hospitalized with COVID-19. If there were 10 centers of this scope in the United States that each had a 1,000-bed capacity, that 1,000-bed capacity would have been reached by the 63rd day of the pandemic, which would have been March 28th, 2020. By March 28th, 2020, the American healthcare system had put patients into over 1,500 hospitals across the United States. There were over 197,000 confirmed cases, over 2,000 deaths. The American healthcare system, by the 63rd day, lost $50 billion. 15.9 million Americans had lost their job in the first 63 days. The Dow Jones average and the Standard & Poor's were down 32% and 34%, respectively. If 10 of these centers existed that could have had the skilled workforce, the supply chain, the diagnostic testing, the bed capacity, and the research to absorb the first 10,000 Americans stricken with COVID, geographically distributed across the United States, I would suggest we would be in a totally different place at this time. And this is exactly why the Department of Defense, Health and Human Services, Homeland Security, the Veterans Administration, and so many others are so laser focused on getting this done.
Dr. Gold, yesterday the CDC put out a concern about another surge. The president's asking everybody to still keep wearing their masks. On a scale of 1 to 10, how concerned are you about another serious surge popping up?
So there are a number of factors that support the CDC's concern, and I do share it. One is the increasing number of variant virus strains with significant amounts of resistance to both vaccines and to reinfection. The so-called P1 strain, which is the strain identified from Brazil, the B1351 strain, which is the strain identified from South Africa, are very complex in terms of their resistance to the vaccines. We know that the vaccines are effective, but they're somewhat less effective, and we have seen considerable growth of that in this country. We actually have identified the UK strain in the state of Nebraska. We've identified the California strain, which is also more transmissible in the state of Nebraska, and we've identified the P1 strain in the state of Nebraska. Add to that, we have any number of individuals that are coming back from spring break. We're heading into the spring holidays, the Easter holidays, which are typically family events. And then, as I travel through the streets of Omaha, I see any number of young individuals enjoying themselves in public places, many of them not wearing facial protection, indeed what I like to call pandemic fatigue. And so it is a race between the time it's going to take to get the vaccines distributed, particularly to the younger age groups as they become eligible, because they are the highest transmitters of the virus, and how fast these variants spread and whether or not pandemic fatigue sets into the point that we can possibly avert a fourth spike. I hope that doesn't happen, but hope is not a plan. And so we plan for the worst and hope for the best.
Dr. Dole, should the state be tightening restrictions instead of loosening them?
I think the state, and I know the state, is watching the numbers very carefully. A good deal of the decision-making for the state is based upon hospital utilization and hospital staffing and supplies and things of that nature. And hospital utilization is well down. And we were down to just over 100 Nebraskans hospitalized as of midnight last night. And, compare that to the peak of just under 1,000 about 12 weeks ago. So we've had a dramatic change in hospitalization, and that's due to the fact that we've been very successful in immunizing residents of long-term care facilities who are the highest risk for hospitalization and for fatality. What we now have to do, of course, is continue to limit transmission. And so I would say we just need to continue to monitor the data very carefully. When your turn comes, get your vaccine, wear your mask, socially distance, wash your hands, all of those things we know, and we'll get through this. I think the rate of vaccination in the state of Nebraska is one of the top in the country, and if we can maintain this pace, we will get to herd immunity, and we'll probably get there before many other parts of the United States, assuming we can maintain this pace.
So you don't see a need to tighten restrictions right now in Nebraska?
I think, frankly, I think the next 7 to 10 days will tell the tale as to whether we need to do that, whether the recent small case increases are going to be predictive of a larger problem. If they are, that will be reflected in hospital bed utilization and other resource utilization, which will feed the data for local and statewide decisions regarding directive health measures. As you probably know, the university just produces data and advises, does not make policy.
But is it not your responsibility to advise policymakers and those in leadership, community leaders, to make those decisions in the name of public health?
We can and we do, constantly. Thank you.
Councilman Jerem is here. He's not running for re-election right now, but he is probably doing cartwheels because of this MOU. It's in his district. I know he's very happy about it. I'd like to ask him if he wanted to just say a few words.
Thank you, Mayor. As someone who was on the council at the early days of the idea of what became the Buffett Cancer Center, and also able to see the transformation to our city created by that project, with the relatively modest investment made at the time during the last great recession that our country experienced, and to live through its transformation of our city in terms of jobs in Midtown, and then to be a part of what became the Davis Global Center, which we called IXL at the time, to see what public-private partnership and investment could do to transform that service in that part of our community with jobs and return on investments. When that got completed, I just happened to mention to the Chancellor, what's next? I didn't think it would become the name of the next project, but it's a very exciting time in our city, and a very wise, experienced community leader and former chairman of the board of Kiewit told me, Chris, it's really not complicated. This is about private partnerships with the public that have transformational impact to our community. It's about investment and return on investment. And it really is, at its basic core, that simple. This will create thousands and thousands of new permanent jobs. It will create tens of thousands of people working construction jobs. Look around our city, look around the campus as to what's happened in the midst. I live just south of the Med Center with my wife. It's where we raised our daughters. And to see what's happening in our neighborhood alone, with people coming in and taking, old homes and really gutting them and adding to them. This will create a sustainable Omaha for generations to come in terms of what we need as a community to have economic development, permanent jobs, transportation systems, things that are places to enjoy, live, work, and play. And I'm just delighted to be a part of it. The council has demonstrated their willingness to support such projects in the past. I would anticipate they do that in the future. And this is exactly the sort of the thing that I envisioned and endured the pains of having the Altria group mail against me into my own district when I championed the tobacco tax several years ago. So I'm delighted to see this come to fruition. And in answer to your question, Joe, before, this has been going on for years. This doesn't have anything to do with any campaigns that are going on now. I've been in those briefings for years.
Thank you, Councilman. Any last questions? Yes.
If this plan does come into fruition, how will it affect those communities, like say on the stretch of Leavenworth, those, dive bars, those neighbors who have been there for decades, and you're talking about other people, especially those with UNMC, coming in and restoring these places. What about the people that live there? How will they be affected by this project?
Well, I don't know. Dr. Gold, do you want to? I would say, the Med Center is expanding as we speak. They've been doing it for years and years and years, and expanding by buying up some property around there. But in return, we see incredible growth of the Med Center, incredible employment opportunities and development opportunities. It's a matter of restoring the neighborhoods that are there, and it's a matter of growth at the same time. And you could do both, is what I have always said, all around Omaha. And you see that in many of the developments that we have now, the Blackstone area. You could see development, you can see new happening, and you could see preservation of the old at the same time. So, Dr. Gold, do you want to make
Sure. No, I think that's a really important question. So all of the current plans include property that is currently already owned by the university. So the site for the Project NExT, as we call it, is on the corner of Saddle Creek and Farnham. There's approximately 7 acres of land there, which has been vacated when the Monroe Meyer Institute began its move to Pine Street. Ribbon cutting officially will be in early June, but there's a brand new facility for the Monroe Meyer Institute for Developmental and Intellectual Disabilities, completely financed through public dollars. It's a phenomenal facility. We'll have a great ribbon cutting, and hopefully you'll be there. But the entire property for this 2.5+ million square foot facility will be contained at that location. The university also owns much of the land just west of Saddle Creek between Dodge and Leavenworth, and that is an economic development zone. And a lot of that is the area that we're talking about as well, because think about it, we're going to need quite a bit of surrounding property in order to entertain a construction project of this magnitude, let alone the mixed retail, residential, hotels, other things that will be necessary to complete the project. And that's the envisioned use of the land that is west of Saddle Creek. But again, that is almost completely owned by the university now.
Any other questions? All right, thank you all for being here today. Appreciate it.